Welcome to our Facebook Live segment for today, April the 2nd, 2018. This is called Ask Dr. Furlong. This is our live segment we like to do about once per month. And today we have a very special guest. This is Dr. Mona Sane, and Dr. Sane has joined Furlong Vision this past October, just a few months ago. Dr. Sane comes to us with some excellent credentials. I want to welcome her to our practice and also welcome you to this segment of Facebook Live. It's your first time doing this, so welcome. We're going to have some fun today.
Thanks, Dr. Furlong. This is indeed my first Facebook Live segment, and I'm excitedly looking forward to this.
Great. Well, I met Dr. Sane over a year ago, and I was thinking about how I might introduce the reason why we brought her into the practice. Dr. Sane, like myself, is an ophthalmologist and has specific training in cataract and in corneal diseases, refractive surgery. And when I met her, I was interested in bringing another surgeon on board, and here's a perfect example. This morning I was seeing a patient, and he looked at me and he goes, "You know, it's taken me 2.5 months to get in to see you today. It's really hard to get an appointment here. And my staff has been telling me that our waiting times to come in and see us have grown over time. And part of that is because of the success of the practice and the success of supporters like yourselves for the services that we offer. But this is a time where technology is really starting to take over ophthalmology, and our services are in greater demand. Patients are living longer, so things like cataracts we are seeing much more of. And Dr. Sane has impeccable training, and I want her to tell us a little bit about your background, where you're from, what your training was like, and how you came to California.
Thanks for the introduction again. I grew up in central India, in a city called Nagpur, and we did move around quite a bit in the country and outside the country, but that's where I spent my major childhood days and did most of my schooling. I did my medical school from Government Medical College, Nagpur. And after that, I did my residency in ophthalmology in southern India in an institute called Aravind Eye Hospital. It was, and I think it still currently is, the largest eye hospital. And I got a lot of training in performing cataract surgeries of different complexities. After that, I continued to work there for a couple of years in the same institute and in private practice. And during those years, I met my husband. He had been working in California as an engineer. He happened to be visiting India to meet his friends and family. We hit it off, we liked each other, and we decided to get married. So here I am. I came here in 2009. I enjoyed a few months as a homemaker. Then it was time to get back to work. I did 1 year of fellowship in research in San Francisco with Dr. Alan Scott, who's a pediatric ophthalmologist. Then I did residency in ophthalmology again at SUNY Buffalo. Following that, I did 1 year of fellowship in cornea, because during the last couple of years in residency I realized that I was really attracted to the specialty of cornea, because it had been improving so much. There were so many new technologies that we could use for improving patient outcomes, especially those whom having corneal diseases.
Well, and one of the things I'd like to point out is even though you had excellent training and experience in India, you have to repeat a lot of the training when you want to be an American ophthalmologist. So it was essentially 4 additional years of training after you had been expertly trained, and that's just the way the system works here in the United States. And during your residency, I understand that you had some great honors as well. I've taken these same exams, and she multiple times had attained 100th percentile on these board exams, which is very, very impressive. So congratulations to you on that.
Thank
and
you.
Then you actually did your 1 year fellowship in Pittsburgh with a friend of mine that I met over 20 years ago, who vouched for your capabilities very strongly. And one of the reasons why I thought it was a good match that you joined the practice here. Can you tell us a little bit about when you relocated to California and what you've been doing since?
Sure, yeah. I came here in 2009, and that was the first time I came to California. And after completing my training that included residency and fellowship on the East Coast, in Buffalo and in Pittsburgh, I came back here in 2016. I did 1 year of private practice before I found Dr. Furlong's practice, and the reviews were impeccable, and I knew that I had to join his practice so that I could work with his awesome team. I could also use his expertise and give state-of-the-art technology and the best care possible to all our patients who wanted cataract surgeries or who had any corneal problems.
So not all ophthalmologists utilize the latest technologies, for example, in cataract surgery, and one of the things that I've been attracted to is being on the cutting edge of what we can offer to our patients. So one of the things that we've been doing for many years here, and I know you do as well, is something called laser cataract surgery with advanced technology lenses. Can you comment a little bit about your adopting of that technology and what it's meant for your patients?
Sure. I was trained in performing laser cataract surgeries during my fellowship in Pittsburgh, and I'm very excited to offer that to patients who are looking for it. The basic difference between laser-assisted surgeries and a regular manual surgery is that in a manual surgery, the surgeon uses handheld instruments like blades and instruments to perform most of the surgery. For example, a blade is used to make an incision or a cut in the cornea, in the outer part of the back of the eye, to get access to the cataract inside the eye. Then the surgeon uses a needle to make an opening in the front of the cataract, and then the surgeon uses a machine called phacoemulsification machine, which uses ultrasonic energy to break the cataract into smaller pieces so that they can be taken out safely from inside the eye. When we use laser technology, all these crucial steps are basically taken over by the laser. So steps of making the incision are done by the laser, steps of making a perfectly round circular opening in the center of the cataract is done by the laser, and the laser even cuts the cataract and fragments it into smaller pieces. This means that less amount of ultrasonic energy is used to break it down further, and sometimes you don't even need that ultrasonic energy. So all this translates into better predictability, better accuracy, more perfection, which helps in achieving our desired goal of as perfect vision as possible.
Yeah, I agree totally. The laser does what I tell our patients is it does the more challenging parts of the surgery and standardizes them to a little bit more of a uniform outcome. And it doesn't mean that we're not trained to do it manually as well. We still do that for our patients. But for those that choose the laser option, it does facilitate recovery time and accuracy of the surgery itself. You're also trained as a cornea specialist, which involves some other procedures. Talk a little bit about what partial thickness or full thickness corneal transplants and what type of patients that might benefit.
Sure. So let me begin by talking about what a cornea is. It's basically the transparent curved portion of the front of the eye, and its job is to allow light to pass inside the eye to form a clear and a sharp image. In order to do that, it has to be transparent and clear. Certain diseases, certain injuries and infections can affect the transparency and cause haziness, swelling, and scarring of the cornea. Generally, it can be treated with medications, contact lenses or glasses, but when that is not helping, then the solution is to do a corneal transplant, in which we basically remove the diseased part of the cornea and replace it with a similar healthy corneal tissue which we obtain from donors. There are two basic types of corneal transplants: the full thickness corneal transplants, which, as the name suggests, we are removing the entire thickness of the diseased cornea and replacing with the entire thickness of a healthy cornea. And this requires multiple sutures. The healing time is a little bit longer. Then we have the partial thickness corneal transplants, where we selectively remove only the diseased layers of the cornea and replace it with a healthy corneal tissue. It allows faster visual recovery, the chances of rejection are much less, and the patient can start seeing better in a few weeks. So it's all exciting.
Well, that's a great summary, and just to put it into perspective, cataract surgery is very common, and over 2 million are done every year in the US. But corneal transplants are not as common because we don't see as many people here with diseases of the cornea that necessitate that. So having somebody who actually specializes in this is pretty rare. There's lots of ophthalmologists around here, but only a very small subset will do corneal transplant surgery. What's also very common in California and other areas where we get lots of sunshine is a condition called pterygia, where on the white layer of the eye can kind of grow onto the cornea, and in severe cases can distort vision and cause scarring. So can you comment a little bit about what techniques you use to remove pterygia?
Sure, yeah. So in the earlier part of the pterygium, it's just limited to the white of the eye, and it causes symptoms like irritation, burning, tearing. Eventually it starts growing onto the dark part of the eye, and that's when it becomes more conspicuous and more obvious. It might even distort the shape of the eye and can cause some blurred vision. In the initial phases where the pterygium is not as progressed, we offer medical treatment in the form of artificial tears, non-steroidal anti-inflammatory drops, and even steroids. They generally help in controlling the symptoms of irritation and burning, but they do not halt the progress of the pterygium. If it's progressed enough that it's affecting the vision, it's affecting the appearance cosmetically, then I offer a surgical procedure to remove the pterygium and then to cover the removed part, the exposed part, with either healthy tissue, similar healthy tissue which is taken from some other part of the eye, like underneath the eyelid, or we even use something called amniotic membrane, which is obtained from placenta, and it works great because it has healing properties, it's anti-inflammatory, so it works great. There is another medication which we often use, it's called mitomycin C. It basically stops the multiplication of the cells and minimizes the risk of this growth happening again.
We do see a fair amount of this in California, and one of the things that, I don't know if any of you have seen this, but in people who have these, the inside corner of the eye is usually very red and irritated, and patients complain that it's kind of, it gets inflamed a lot, and it's a chronic form of irritation. And even though it may not be affecting their vision, they're a little bit more conscious of it. They're feeling a little bit subconscious about it because people will comment and say, "Why are your eyes red all the time?" And sometimes when it becomes a surgical issue, this is one way to fix that. We'd like to invite you to submit questions if you'd like for me or for Dr. Sane or for any of the services we provide. In addition to some of the procedures we haven't talked about, like LASIK and PRK and implantable lenses for nearsightedness as well, Dr. Sane brings a wealth of experience to the practice and has really helped already reduce some of the wait times we've had for patients to come in and seek our services as well. Can you talk a little bit just about, we kind of glossed over the lens implant part of cataract surgery, and we call these advanced lifestyle lenses or advanced technology lenses. Tell us a little bit about how these lenses might benefit somebody who is about to have cataract surgery.
Sure, yeah. The intraocular lenses that we implant after a cataract surgery are of two types, broadly speaking. One is the monocular lens, also called standard lens, or monofocal lens, which is also called a standard lens. And as the name suggests, it is focused for one particular distance, generally for far. It gives great crisp vision for far, but for near, you would need reading glasses if you want to see clearly up close. If you want to have a kind of lifestyle where you want to be as independent of glasses as possible, then the option is to use advanced lenses, also called multifocal lenses. They give not only good vision for distance, but even for intermediate and near. So activities like working on your computers, reading books, looking at your iPad or iPhone, and still being able to see far up, this is a really great option for those kind of activities. And not only good vision at all distances, it also has a feature for correcting astigmatism if a patient does have that. So it's a great solution for people who want to be as independent of glasses.
Yeah, and we're seeing patients, people are living longer and they're staying healthier longer. So a 75-year-old today who has cataracts may not be the same as they were 20 years ago. They were still very active, some are still working. And with that active lifestyle, the freedom from glasses is very attractive for a lot of our patients. So great summary on the advanced technology lenses. We've only got a couple of minutes left. I did want to make one announcement. We are in the middle of voting for Best in Silicon Valley. My practice has been blessed to have been voted best place for LASIK surgery for 10 years. The voting is open for the next week or two, and I'd encourage you, if you could, is to go to our Facebook page, and there's a link there. You click on it, and it'll take you to the page where you can vote of best place to have LASIK and best LASIK surgeon as well, and we would appreciate your support there. Do we have any questions we'd like to take before we wrap up today's session?
We have a question from Adam. He's saying, how soon can I drive after cataract surgery?
That's a great question, and it's a commonly encountered question that I get. Generally, after cataract surgery, your vision is going to be a little bit foggy the day of surgery. By the next day, most people will start seeing pretty well. In fact, many of them just drive themselves to the clinic the day after surgery. And by 1 week, it will have plateaued, and you will be able to function with that vision and do most of your activities.
Yeah, very, very little downtime with regard to
Yeah.
cataract surgery. Patients function well pretty much the next day.
He had another question. Is it okay to shower after having cataract surgery?
Oh, good. Another nice question. Sure, it is okay to shower after cataract surgery. The only thing I tell patients is to keep your head towards the shower and try your best not to get water into the eyes to minimize the risk of infection. Use a towel to clean your face around the eyes, or just keep your eyes closed if you feel that water might enter into the eyes. I do advise patients not to swim for about a week or so after cataract surgery.
Right, well, thank you for that nice summary. We're at the end of our segment today. Thank you for watching our Facebook Live segment. Again, thank you very much, Dr.
Thank
Sane,
you.
for joining us today. Hopefully we'll see you on one of these segments in the future, on a
Sure.
future topic that interests our viewers. If you have other questions that we haven't got to, we will answer those, so just check the feed later. And again, go to our Facebook page and find the link and vote. Thanks.
Thank you.